Get your big head off the screen.
We use it said right.
You're standing right in front of my camera.
I was like, I will fire you.
Where's your camera
Who farts during fart?
Well, maybe you ought to have a better location.
Sorry.
Oh, yeah, now that's
See how I eat.
not
at?
really.
Everything you're saying can be heard from everybody that's watching.
There's
Probably nobody.
It's not gonna be long
Not that one.
We ready to get started?
It's okay with this baby.
DJ,
We're live streaming, so yeah.
or Daniel and TJ.
We got a couple other people from Star that's on their way, they're just running behind.
Well, they just got run.
I don't have a clue what Bloomington's doing, because they're all work.
Oh, Bloomington is trying to go down there?
I got a couple from Bloomington. You guys have a good night. So, Michael, would you like to introduce your, I guess he's busy.
Probably introduce myself.
I didn't say I had lots of girls here, just passing off.
You say, were you just passing it off?
So for those of you who don't know,
Babies here.
we are live streaming.
15, 4, 24 inches. Big ass one.
Oh, yeah.
All right, everybody, this here is Jerry. Somebody share my post or how did you find
I
it?
believe it was. Somebody that I know shared your post looking for somebody to come.
Maybe
join us.
it's Sonya, because she told me she did that.
I don't think it's Sonya. I don't think I'm present on Facebook. I don't remember.
She spoke very highly of me.
We had a good time together too. Oh, we had fun.
But this here's Jerry. Jerry, if you want to tell a little bit about yourself and the gazillion years you've been doing this, because I know if you trained Tanya, which she said you got to give him that, it has to be a long time because she's been doing it longer than I've been in this.
Right, right. Yeah, it's been a while.
Been a minute.
Hi, everybody. First, before I do my introductions, I just want to thank you because what you do is something I could never do. It's awesome. I mean, you guys have to come out and on the things that are, you don't even know what you're walking on. You know, I'm a nurse. I don't have to do that. I admire what you do. I was very, very happy to know my EMTs and paramedics. Amazing. So anyway, my name is Jerry Taylor. I graduated in 1979 from ISU with my bachelor's of nursing. And then I went back when I was 50 years old, got my master's and began to teach nursing. And I taught nursing at Ivy Tech for 13 years. And the majority of that time I was teaching pediatrics. So that part is not really hands-on stuff. Well, I mean, I worked in the hospital with the students. But as far as the other stuff that I've done over the years, I'm not gonna go on and on because obviously that my resume is like 16 pages long because I like to move around. But what I did do, I did some things that I feel make me competent enough to talk to you about and maybe hopefully to learn something. But I guarantee each one of you has got a story I'd like to hear. So, it's not anything different. Okay, so I also worked at the health department in Vigo County. I did that for 7 years, and then I worked at the state of Indiana Health Department of Health for a few years. I was a vaccine educator for the state of Indiana, traveled around doing presentations. But at the regular health department, I worked in the pediatric clinic, what we call the Well Child Clinic. So we took care of kids. If we have time at the end of this, I'm going to try to talk to you, share a few funny stories about working with kids in those kind of settings. I think you might enjoy it, unless you're sick of music. What time are you supposed to be done, out of curiosity?
When you're done, when you say we're done.
What is it usually?
Or we have to leave.
Or you have to go?
Well, as far as those guys, whenever they have a run, my guys usually about an hour is what we do.
Okay, all right.
If you run over, it's not gonna break nobody.
I don't think I will, because some of this stuff I added just in case we had more time.
Okay.
Okay, I also worked surgery, and most of the time in surgery, I worked in a place where we did kids. So I've dealt with pediatric emergencies in a surgical setting as well. Then I worked in an office that did kids primarily, ear, nose, throat doctor, and that brought me into some emergencies as well. When parents think there's not anything serious, and they it makes much more serious than they thought it was going to be. So the first thing I just want to talk about, tell me to stop talking if I need to, if that, if you need to listen, okay? Because I was
You're good.
I know I'm loud, so.
You're good.
Okay, so the first thing that always comes up, and I'm certain you already have realized this, that children are not little kids. They have a lot of other considerations than just thinking they're miniature adults. I thought it would be good to go over a little bit of growth and development that I think that would be might find beneficial. You probably may, how many of you are parents? Most of you parents? Okay, all right, so let's just talk about this. Let's just see how it goes. I first want to talk about infants. We have an infant. That infant will go to anybody because they don't really have a, they're happy. They want to go to whoever wants to hold them. You bring a baby to about 8 months old, that baby's afraid of everybody and only wants its caregivers taking care of it. So why am I talking about that? I'm talking about that because if you come into a situation and the kid's screaming and you know that you can take them or you know you cannot take them, you just recognize how old they are. If they're 8 months, you're not going to be able to comfort that child, is kind of what I'm saying. You say, you're not going to be able to comfort it unless you're drunk. The toddlers, another set of circumstances. Hello. We're going over just a little bit of growth and development right now. Toddlers, what's a toddler's favorite word? No. And so there's no point in asking a child if he wants to do something or if he will come with you. Because he's going to say, no. Now, that can work to your advantage if you're trying to get them to do something you really need them to do. Whatever you want them to do, ask them second. So if you really want let's just say your own kid, take a bath. And the kid says, no. And you say, well, do you want to brush your teeth or would you like to take a bath? They go, take a bath. You say, great, let's take a bath. So it can work to your advantage in the field as well when you're trying to get cooperation from a toddler. Is to remember what it is and the last thing you said is what they're going to say. It helps me a lot over the years. Preschoolers, literal. You have to watch what you're saying. Have you ever taken a kid, maybe about 2, 3 years old, to the place to get their hair cut? And as soon as they get there, they start screaming their head off. I just go, just go cut your hair. Calm down. This is not going to hurt you. What does the kid hear? You're going to cut me. So you're going to go trim their hair, not cut their hair. So if you remember keywords of the literal meaning when you're taking care of your patients, it can sometimes help you with the distress your patient's going to feel. You have to think literal. Another thing we say as nurses a lot is it's going to be a little stick, like a shot. A little stick? Well, we just picked up sticks in the yard. They're huge. I don't want a stick. It's going on me. So those are not words you use with children. Literal. Another funny one I get a kick out of is if you say, we don't use these phrases too often anymore, but people used to say, oh, it's raining cats and dogs. You say that to a child, where they go onto the window because they want to see that. I'm still waiting on the raining men thing, but it never works. Let's see. They also think they are a bag of blood. That if they're cut, they're going to just pour out. It doesn't matter if it's a scratch. They're going to bleed. So if they're truly bleeding, not only are they in pain likely, and not only are they truly maybe in an emergency, but they in fact think they're going to die. Now, that age group does not understand death, but they do understand being in such severe problem that you're not going to survive. They don't really get the concept of the permanence of death. If you tell somebody that has died, the kid will say, well, that's sorry to hear that, but I'm sure he'll be back Sunday to take me to the ball game, because they don't realize the permanence at that time. So that's why this age group absolutely loves Band-Aids, because they don't want all the blood to come out. So there again, that's just something you can reassure them. You can put a cover over it and try not to let them see it. When you're putting pressure on something, that's appreciated because you're keeping that blood inside and they don't want it all over the place. They don't want to lose all their blood. It's kind of funny when you think about it, but you can imagine how scary it must be for the little fellas. Under the age of 8, I mentioned this about the no understanding death. Under age of 8, it does depend on the family and the children and the experiences, but up until about age 8, they don't understand that death is permanent and irreversible. So that can be to your benefit, that sometimes when you're talking in different situations, there also can cause some problems. And that's why you'll see kids around 8 to 10 years old that will find themselves worrying about when their parents die for the first time. You may remember doing that yourself. Where you start thinking, oh no, If they die, I can't take care of myself. So that's why they're doing that. They finally got the idea that death is permanent and irreversible. Then this one I just threw in there. It's not really to go with anything, but I kind of always get a kick out of it. You ever been to a Little League game or a T-ball game? You know, the kids are out there picking flowers and jumping backwards and sitting down or running around in circles, not really particularly playing the game. The parents like it, you know, so they can yell at each other. But the age of 10 is when children actually begin to understand rules. So when you have a situation like for me in a doctor's office or something, when I say you have to do this and this and this, your 10-year-old's gonna understand that they have to, because they like to follow rules. Before that, they don't care about rules, they don't understand that. So when you guys are doing your training, were you taught to use the FACES pain scales for ask a kid about their pain? What do you remember about how long you used that? When do you stop using pain faces? Kind of depends, doesn't it?
Never.
It would actually work forever, wouldn't it? But the thing is, if you try to, you don't know the answer to that, or you're not sure which scale you should use, just ask the kid, which is the bigger number, 1 or 5? And they might know those numbers, but they don't realize they're bigger. So once they understand that the numbers are bigger, you can get off the faces. That's just a little tip. Oh, and the other thing, of course, this goes along for many adults too. When you ask somebody about a pain scale, and you say 10 being the worst possible pain you can have, and they say, well, it's a 10. And you see that a lot with kids. And I always smile because that is the worst pain they've ever had, most likely. They've got something broken and it hurts. That's the worst pain you could possibly have. So I don't put a whole lot of clout on pain scales for kids. Where I get that. Teenagers like to be treated like adults. You haven't run into that, or if you have some, you don't go in and act silly and talk their lingo. And we were just talking about, my grandson lives with me. He's 20. We were just talking today about all the new abbreviations, the young people. He thinks he's pretty old now that he's 20. And he was telling me all these different codes and letters that people are using. I know a few of them, but I'm not going to talk to a teenager like that. As you know, most medical professionals are valued in the eyes of patients. They see us as intelligent, caring, and very professional. So you don't want to go in, yo, what's up? You don't do that, because they would think you're ridiculous. Kind of would be. So you just try to remember they want to be talked to like adults, essentially. You should try to talk to their parents to them instead of their parents whenever possible. And always ask the kid first if they're able to talk to you, if they can explain what's going on or where they hurt or whatever. And then you can just ask the parents if they want to add anything. But try to talk to the teenager first, if you can talk to the teenager. And then the other thing too, with these little guys, always try to talk at eye level. And that's, you come in there and you're towering over somebody, try to squat down if you can. If you can get lower than you are, that would be wonderful. But it's best to try to be on eye level with kids, if you can be. Those are things that I've learned over the years, just little pearls that I like to call them that have helped me take care of kids along the way. But kids are funny.
Assessment also, you started to feed and work your way up. So
Somebody says that.
Right, that's a good point. Absolutely. I got something to say about assessments too in a minute. Let's see. The other thing with kids, as you are aware, that many times the injuries or violence that's happened to them is caused by somebody else's hand. So it's important to always have your eyes open for anything. Always remember, I'm sure you know a lot of this, and I don't mean to be talking down, but I just want to throw it out there, that you don't ever want to say it looks like child abuse. You write what you saw. You never write it looks like, because that's a diagnosis thing. But over the years, I've seen some really strange abuse. We were putting a kid to sleep in the surgery suite, and when we rolled him over to put the the monitor on his back, he had a pentagram drawn on his back. He didn't know that. So it's things like that you're always looking. You're looking for assessment things. and document it. Just write it down, put it down, let everybody see what you're doing. And hopefully, if there's a problem, you might be the first one that noticed it. That's a good thing. I saw a lot of kids that had other types of abuse that was not fun. Sexual abuse. I had a little girl one time, she came in with venereal STDs. I can't say venereal. With STDs, and she was too happy to show us that. Little kids don't like to be looked at like that, but she was used to people looking at her like that. It was heartbreaking. But we got her pulled from the home before she even got out of the building. And then I had a kid, ever seen anybody, hope not, with Munchausen syndrome? Munchausen, you know it?
Yeah.
Munchausen, where you put the symptoms on somebody else or on yourself. By proxy is, yes, when you put it on someone else like your kid, or if you just have Munchausen syndrome yourself, is when you fake a bunch of diseases and stuff so people feel sorry for you. But there was
Quite a few people in Brazil.
yeah, there are a lot of those. I remember one kid, she was only like 8, she'd had a heart cath, she'd had many hospitalizations, numerous doctors, numerous places that she'd been, and her nose was absolutely full of foil and other paper and stuff. She was too old to be doing that. Someone was doing that to her. So, it was sickening. But anyway, that's the kind of stuff you want to watch out to.
Can we back up for a second? You said, if you suspect child abuse, don't ever say, I suspect child abuse.
Well, you might say it to your coworker.
Right, but for documentation
Go right
purposes.
You
Then
say,
how would you recommend that?
well, I'd say, I see red welts, they're 3 centimeters wide, and they're spaced evenly in squares, sort of a similar shape to a belt buckle, you know, whatever it might look like to you.
Yeah, okay.
And then also the other thing you always want to look at too is if you've been called to a kid that's burned, okay? Burned by scalding water, let's say. Most of the time when a little kid is burned by scalding water, like a bathtub, they're going to fall in head first. So your burns are usually going to be at the top. They don't generally step into hot water. Doesn't even mind, but maybe just one leg. But you want to look at that because people that put babies into hot water, the baby's toes will touch the hot water and go, eh, and then they put it down. And so the burns, there's none on the backs of the legs because the legs were all contracted up. So you look at that stuff, it's usually child abuse, but you don't write that. You say the burns, this is where the burns were, or however you charting goes. I don't know how you guys chart. But you want to write what you saw, exactly what you saw and where you saw it. The other thing I saw several times where people would take a baby's head, burn it on a stove coil. And if you saw that, the coil, when you could see the coil, well, when you're only this tall, your hand's not going to fit like that on a stove. You're going to hit the edge of it with your fingers. So if your fingers are burnt, that makes sense. It still could be a problem because somebody still could have done it. But if you've got a full coil on their hand, it's not possible for their height. And they wouldn't do that either. They wouldn't just go up like that. They'd go if they did touch it. It's those little things that are important to catch when you're doing your job. It's just to alert other people. And you may be totally wrong, but that's okay. Wouldn't it be better to be wrong than miss it and do this whole thing? Yeah. So don't worry about it. Write what you see and tell the next, whoever you hand off to, the hospital or wherever you're going, tell them. And then sometimes, I used to teach at this class where we assessed people, but we didn't touch people. It was called assessment without a stethoscope. And I can do this, anybody can do it, but I want to show you how to do it because it's really easy. Will somebody come up here with me that doesn't mind standing here with me? You don't have to do anything. No? Nobody wants to come over here? He's coming. Okay, so now I'm not going to touch him. Okay?
Come on.
All right, so let's just talk. Tell me, do you live here?
No,
Where do you live?
Saline City,
Saline City, that's kind of far, isn't it?
about 5 miles.
Oh, it's really far. See, I don't know my geography very well. No? Do you have a dog?
Yes, 2.
What are their names?
Brody and Sis.
And, do they live in the house?
Yes,
What kind of dogs are they?
miniature shots.
I got a Yorkie.
I'm sorry.
Yeah, he's a puddles. God, dumb dog. Okay, all right, I finished my assessment. Okay, you can sit down. Okay, what I
What was my
saw.
heart rate?
No, I don't get the vitals, you can't get vitals, but I can tell you weren't distressed, you were breathing at a normal rate, okay? I saw no distension in his veins, in his neck. I saw that his eyes were clear, there's nothing, no drainage from it, he's not wearing glasses. I noticed that his teeth appear straight, I didn't get a good look at him because they didn't open his mouth very far, but he does have teeth, it looks like a full set. He's of normal body weight, height, his clothes are generally clean, he's been working, he's got work boots on.
No, that's just big.
You're right, I have been working.
There you go. But then, what's the point of that? Yeah, the point would be that you just picked up a kid, okay, the kid's hurt or injured, and you can't really just touch the parent, you kind of like get a feel for if this is something, the connection or what might have happened. Is the mom delusional? He answered his questions just fine, he didn't hesitate with the dog thing. I didn't care what his dogs were. I mean, I do, I appreciate you told me about your dogs. Dogs are nice, I prefer cats. My last cat just died when he was 20. And then somebody, you know who gave me my dog? A former student showed up at my door one day, and everybody knows I'm a cat person. She shows up at my door and she said, you know, you changed my life and I want you to have a pet now that you're retired. I said, you're giving me a whole dog? And it wasn't even much of a dog. It was like that big. Only dogs I ever had weighed almost 200, I had Newfoundlands. So I've never had a little dumb dog. But he's turned out to be not as dumb as I thought he was, but he sure was hard to potty train. Oh, am I talking? Okay. So one of the bigger problems too, as you know, with kids is there's smaller airway and smaller everything. And you get a snotty cold and you're coughing and snotting around and you feel like you're choking on it. Well, they really do choke on it. So they've got a disproportionately large tongue and very small airways, so that's why everything affects them is so much more difficult. They show very obvious signs of distress in most cases, but the respiratory emergencies are usually the top emergencies. Would you agree with that?
Yeah.
Yeah, okay, that's what I thought.
Crew.
They have faster heart rates than normal, obviously, so you can't just quickly take a pulse and refer to your adult vital signs because obviously theirs are going to be different and faster normally. Their increased sensitivity to fluid loss as well, and that's also partially because you can't tell them to drink if they won't. If their throat hurts, they're going to drink. They get dehydrated, then you're dealing with that whole situation where they're going to have their fluids replaced. They're pretty good at hiding shock. Have you seen that? When they're bleeding? Maybe not. They take a longer time to decompose. I don't think they do. But anyway, to decompensate. So you're going to see the heart rate is going to stay, or the pulse is going to stay elevated longer than it would in an adult. And then as it crashes, they crash fast. So getting fluids in obviously is your first goal, is to get the IV fluids as quick as you can possibly get those in. So I'm not going to say this, but you know you gotta have appropriate size equipment. Seizures. You see many seizures with kids?
Yep.
Yeah. Febrile, yeah. And that's the funny thing too about kids and fevers. You know they can sometimes be 105 degrees and you're just fine, running around like nothing's wrong with them. And then the other kid will seize at 102. And if they seize at any time with their fever, they're likely to do that again until they grow up or get older. A child that's never seizured and has had a history of high fevers, they probably will never do it. That's kind of weird. I don't know the reason for that. That I was kind of interesting.
Weak nervous system.
Weak nervous system?
Or enhanced nervous system.
I would guess enhanced. What do you think?
Yeah.
That's what I would guess.
More sensitive
Yeah.
the fever.
Yeah, I don't think any of us want a fever of 105. So when you come up on a scene, what's the first thing you would do in any scene? Let's say car accident.
And that's just ingrained in our head.
That's what I was gonna say, that's the first-
Technically,
That's what I want to say. It's like,
That could be a.
What happened?
Yes, that's.
What happened? Yep,
I'm looking at both vehicles, that vehicle,
what happened?
what happened, looking at the skid marks on the road as we're driving up.
Good. See, that's kind of like my assessment without stethoscope. You're doing your assessment on your property, the property too. I think you all invested that too, above most people in this field. Then we go through the ABCs, and you know when you're extending a little infant's neck, you push it back too far, and they're gonna block the airway. So there's a difference than working with adults when they're pulling so hard and pushing so hard with their jaw. So I said respiratory failure is probably one of the most common thing, and that goes along with things with illness, trauma, asthma. You see a lot of asthma?
Yeah.
Kids, a lot of kids have
Used to, not, yeah.
Why is that?
I think it's just better treated in early recognition.
Okay.
30, 40 years ago.
Air's clean.
And
I
more
was
friendly, prescribed like med treatments, med machines to people to bring home, because I know my daughter never had asthma, but I have a machine home.
So you don't have to call up EMS very rarely, probably.
Better prevention drugs too.
Yeah. You think it's making any difference since they let people stop smoking in public buildings?
That's, yeah.
I think so too, because that's really tough on kids, especially if they're smoking in cars. Of course, a lot of people don't even smoke in their homes anymore, which is kind of nice for the kids not have to breathe all that. Probably helps. Okay. I want to show you this. What do you want me to do? Just go over here?
Oh,
I did this little video, it's very short. I don't want to do it here.
well,
With these two going on, I don't know what to do.
that was recording you.
Free movies and TV. There you go.
Let's watch a movie.
Yeah.
One.
All kinds of good.
Guess we are gonna watch a movie. This video is it's just a few seconds long, but I believe it's the same one I watched earlier. It shows you a little more into the respiratory distress symptoms. I know you know them, but if you haven't seen them, it's kind of nice to see them when you're not stressed and just kind of look at it and understand it. Maybe not. We should tell some jokes.
Catch up.
Yeah, we don't have to keep listening to this, I can just talk about it.
Okay, somewhere. Man.
Yeah.
Sometimes you gotta unplug the HDMI and plug it back in so the signal.
I was sending it because the little pluggy thing wasn't working.
Music.
It's pediatric respiratory distress. I saw Peppa Pig there. While he's looking for that, I will I'll talk about this. I already talked about hemorrhage. Anaphylaxis. That's the next one I've got. Anaphylaxis, the difference in children is it reacts much more quickly than it does in adults. So by the time you get to where you've been called to, obviously they could be much more sick than they would be when they're adults. You seen that? Yeah. You see that a lot?
Not a lot.
But the reason I ask, it seems like there's so many more people have allergies these
It
days.
seems like everything comes and goes in cycles.
I agree with that.
It like, you won't see something for a year and then all of a sudden you'll have 3 or 4 of them in a row and then you won't see it again for another year or 2. And then,
It's weird how it runs around the school schedules.
That makes sense. Interesting. I worked labor and delivery for 18 years, and we would see if we had a fetal demise, we'd get a bunch of them, or if we had twins, we'd get a bunch of them, just in little groups like that. Strange.
Michael said disorders distress.
Say that again.
I told Michael instead of disorders to
Oh.
try distress.
Respiratory distress, pediatric respiratory distress, yes.
There it is.
That little kid right there. Contractions. More retractions. Bigger kid. This one where you can really see how they're using accessory muscles too to try to pull nasal flare. Head bobbing. Have you seen all these? No. Good. These are still kids. Trying everything. Look how blue he is. That's good. So anyway, when you think about all of those, you can kind of explain them when you really think about what you're seeing there. When you've got a narrow airway full of mucus or injury or blood, whatever you've got going on in there, you've got that squeaking, the stridor, the wheezing, just because you've got this little pinpoint area. And you'll notice that head bobbiness of trying to open their airway as it goes backwards. Another thing I learned that kids that suck their thumb once they're older, they have a really damaged or compromised airway, meaning they may have the big tonsils that need to be removed, or they might have a congenital abnormality. The kids that suck their thumb long after normal kids would, they're just making an airway. If you look at that, it is an airway. So just keep that in mind. The other thing what do we see? Stridor, wheezing, grunting. Grunting's forcing. Okay, that's forcing the air. And then where they try to sit up really tall. Have you seen that? And even adults do that. Get in the tripod position. Trying to breathe. That's just trying to make room, stretch it out. Don't lay down. What do you do about that in the ambulance? I mean, you just let them sit up like that?
Set up and
Just let them stay all the way up.
position of comfort.
I mean, the headrest comes up.
Okay, okay.
They'll tell you right away if you try to win them back.
No.
Yeah.
Yeah, if you've ever been short of breath, you can relate to that easily. Then you have GI distress disorders, of course, and that's not often a pediatric emergency particularly, but it can certainly put your kid in the hospital because they are dehydrated, they dehydrate very quickly, and they're not cooperative about drinking in most cases. They're not gonna drink if their throat hurts, they're not gonna drink if their stomach's sick. You can tell an adult, you really need to drink a little bit of this. The way I deal with people that are nauseated, I don't let them have anything for 4 hours. And then for every 15 minutes, they get a tablespoon of liquid. If they vomit, they're back on NPO for 4 hours. And then we try a half hour, tablespoons. Tablespoons. Usually works, usually stops the nausea. But you can't do that with a kid, they don't do that. Sometimes with a baby, if you've noticed that they're extremely drowsy or extremely hyper, because they can say, oh, my kid always cries like that. I have 2 very colicky babies, they cry a lot. But there's a whole different cry between colic and pain. There are videos that you can watch about how to identify pain in an infant. Their mouth will be square when they're crying. And when they're normally crying, just crying, they'll just open their mouth wide, or they'll just a little bit, or do all that. But when they're in pain, it's usually square. So that's one part of your assessment without a stethoscope that you can look at and see. And then, of course, if they're way too sleepy, that's another thing. Can somebody tell me a story of one of your pediatric emergencies so we can talk about it? And then I'll tell you some stories.
Crew,
Nobody has one that they want to talk about?
it was our own,
Go ahead.
and first time we ever, I think it was him. No, may have been Brittany. Anyway, they got the crew. Never heard it before. Bam, what do? Get to the hospital. I grabbed her, ran outside. The wife was tagging behind, being slow, getting this, getting that. And by the time she got outside of an evening,
Was it summer or winter?
fall.
Nice and cool.
Yeah, I was gonna say, where we're going here. Okay.
The time she got out, it was almost normal breathing.
Yeah.
And so we went up, I think, St. Clay, and gonna find out it was crew. Okay. Then after that, we knew what to do.
That's just it.
You started to get crew, throw them in the shower.
Mhm.
And if it didn't subside, off to Terre Haute.
That's an interesting story. I had a couple daughters and they got croup at the same time. And it was really cold. It was back in the early 80s when it used to get really cold. Like, it doesn't do that anymore. But it was so.
You just jinxed us.
Yes.
We just entered our cooling down phase of the year.
Yeah.
For real. We did.
It's about time. This is like sweat.
That's perfect.
Every 7 years, about every 7 years.
I realize that.
Yeah. Doing.
Well, I believe it. The croup story, it was so cold outside, and it was so dry in the house, and they were just barking. You ever heard croup? But we put on shorts, my husband, I'm still married then, my husband and I put on summer clothes. I put 4 pots of boiling water on the stove, and that house steamed up. I mean, it really steamed up. The windows, it was so cold outside too. But that's what we did for the crew. Just, boy, the house would get hot. That's it. The
So
moisture.
you heated the whole house. I threw her in the shower and heated the bathroom. That was it.
Shower on the house.
Yeah, I guess I was a little over the top, wasn't it?
Yeah.
To do that. I should have used the shower.
We used to have humidifiers. I don't know.
Yeah.
You just fill them with water and then it would kind of just heat the water up a little bit and it would just vaporize.
Yeah. Yeah. We used to put Vicks in the vaporizer, hot vaporizer.
Yep.
When I was a kid. And people say that. I've had a lot of people ask me that. Why do I have to get a coolness vaporizer instead of a hot one? You don't. The main reason is so people don't burn themselves. Get hot too close to you. It's not really any better to get a cool one. Okay, so where I am with this, what are we doing? What time is it? That's 6:40.
Sun's still up. We're good.
I want to tell you some stories. Is that okay? I'd like to tell you some stories. Some of these, as I said, most serious emergencies, because I'm not in the field like you folks, have been in my OB world when I worked at labor and delivery. Because we don't have doctors in labor and delivery until they're ready for baby to come out, So we have to do most everything on our own. I have a lot of stories that I don't want to talk about, of course, but I want to tell you a funny one. There was sometimes people would pull up to the hospital and they'd say, the emergency room doesn't like to take care of people having babies, if you haven't noticed that. So they call and say, so-and-so's in the hospital, in the parking lot, since she's having a baby. Okay, so go out there with a wheelchair, take them up, send them home an hour or so later, that's how it goes. So I went down, and you always hurry, because you never know. And it was freezing, just seeing your breath cold. I opened up, she was laying in the back seat, I opened the back door, baby's just crying, ready to come out. So it comes out, and I had nothing except the delivery pack, but I had to open it real fast, that the baby was smoking. It was just smoke rolling off of
This
it.
came out from a slaughter.
Yeah, I saw it in the frigid weather, that was a funny day. Now I tell you another one of those funny stories. Is that okay? Am I boring?
No,
You sure?
should've got your catcher's mitt though. It's up there.
I had another funny.
Push!
I just want to tell you one other funny labor story that still cracks me up when I think about it. I had a patient in labor all day. She wasn't really in labor, they were trying to make her have a baby, induce her. She didn't do anything. So her doctor came in at the end of the day and said, well, what do you want to do? You want to just sleep here and try again tomorrow? Nah, she wanted to go home because nothing had happened. So the doctor says, go ahead. He leaves. She says, well, let's go ahead and get dressed. I took her IV out, got her clothes together, started to the bathroom. She takes 2 steps, grabs hold of the sink, says, oh my God, throws herself backwards and the baby fell. Now her husband was putting the camera away. So instead of putting it away, he just starts taking pictures. And every picture that he took was a picture of me going, it's like, don't stop laughing. I said, this is really happening. This just happened. I yelled out, somebody go get him. He's still in the parking lot, for goodness sake. That's funny. It was funny.
You thought so too.
What was it?
See,
Just like this.
he comes early.
Here you go.
Is it?
Yep.
I very much believe it goes, so. Okay.
Was that a union?
Yeah. That would have been, years-wise, that would have been 88.
Oh, so it was in the really old part, the back, where the wound care is and everything now.
Yes.
Yeah.
Now, you say really old part, see, you
Yeah,
used to have that
yeah.
very big thing, but that's where. it
To
was.
me, it's really.
Yes, of course.
Yeah.
Thank you.
Was you working when the old ER was?
I had just come on and it had literally just transferred. I think I got to take one patient into the old one. Well, the old,
I know what you mean.
old one.
Took many
The
hours.
West, yeah.
Yeah, and then we started using the other one. So, yeah.
Yeah, sure, it's nicer now, weird.
Yeah,
Oh, yeah.
it is so.
How in the world they would ever, if they hadn't built that new one when they did,
Yeah.
they'd been something.
And we took people in there for the longest time to wound care, and you try to get a cot with a person that, in those little bitty rooms that they had over there.
Oh,
it's
yeah.
like, what the?
Especially if you're doing something real severe.
Yeah.
Poor brother Jay fell off the chair out there. That'd be seen.
Oh, gosh. Well,
Do you ever work ER?
the only time I worked ER is a fill-in position, like I rotated there. I never worked there.
Did you know where the EMS, as you go out the front,
What are we talking about, the new?
the old ER?
Okay.
We had that table out there right before you go on out.
Are we talking about the front doors or the emergency entrance?
The
emergency
the ambulance entrance.
The ambulance.
Okay,
entrance.
yes.
There was one of them high chairs, and table was up there, and we brought our reports. Well, they got to messing around, and he actually fell off and bumped his head, and
Yeah, because if I remember right, those were tall chairs.
Yeah,
They weren't
they were.
short.
It's pretty good fall.
Those were,
yeah.
you had to step up on the lift to get up on it and sit down. Yeah,
I had a man that was watching his wife have a baby one time.
like tall bar stools.
Yeah, that's a pretty good fall.
Yeah.
So this man was watching his wife, she was about to have a baby, and I look over and he's going, you know what's gonna happen. So he falls, I couldn't do it. And he cut his head, so we had to take him down to the emergency room, get his head sewed up, and he got back in time to see the delivery in a wheelchair.
That's good.
Yeah, worked out good. Now, these are some more related to what I'm supposed to be talking about. Oh, these are some of the things kids say to me over the times. Well, first, when we used to put kids to sleep in surgery, we take them in a wagon, so that make it fun, a lot of them just scream on the way back. But we take them in the wagon if we could, they would stay there. And one time we were almost to the surgery suite, and a kid jumps out of the wagon, takes off running, runs back out to the waiting room for his parent. It was so embarrassing. We lost one. So they had to go out there, and the parents are looking at you like, are you watching that? So anyway, we didn't quit putting them in wagons unless they were really cooperative. But this one little kid, we were putting him to sleep, and we used to let him sit on the edge of the bed, and one of us nurses would hold him from the back and put the mask on him, and it would smell like bubble gum, but it didn't smell like bubble gum when it had the anesthesia. It was gross. But the kids would kind of fight that because it did smell weird. But this little kid was watching. We always put in Mrs. Doubtfire. Remember that movie? At the very start of it, it plays that jump around song, jump around, and this kid was just dancing, but he wouldn't go to sleep. And I've got this gas going right in my face. And I said, we gotta get this kid down. I'm gonna go unconscious here. Finally, he went down. But he just was pulled. I couldn't keep the mask on. He was just dancing. Then there was a little kid one time at the health department, and I said, "Are you excited to go to school?" We were doing back to school exams. He goes, "No." I said, "Why not?" He goes, "I don't know how to read." I said, "Well, you're gonna learn to read at school." And he goes, "I think you're supposed to know before you get there." Oh, that's gonna be a worried little kid. Mm-hmm. Oh, here's a not so good story. There's, we were working at the health department, and we had this young man that was supposed to come in. Do you remember when everybody had to go back to get another shot when they were like 12, like an MMR or some kind of thing, and catch these kids up on? Kids that age don't like the shots, they're worse than little kids. And this boy came with his mom, and the kid took off, ran out the building. We didn't even catch him. She had to go and get him. He didn't come back. He came back another day with 3 very big relatives holding him down. He said he had to go to the bathroom. When he came out, he sat down, cooperative as heck, did exactly what he was told, walked out, nothing. Went to the bathroom, every single aerosol can that was in there was gone. He huffed them all. Every single, it was lucky he didn't die, but he just calmed himself down.
He's a helper at heart.
Yeah. Let's see.
Is he trying to get in or trying to get out?
Probably that.
What is it?
The ghost.
Oh, is that what you call it, really?
Probably the heat changes.
Oh, it just does that?
Every time somebody farts, it changes the pressure in here. So
Okay.
somebody.
Change in the bell
Ah,
Now
what's some telltale signs that the impending respiratory failure in little people?
Some telltale signs of what?
Respiratory failure in little people.
You talking midgets or babies?
Go ahead.
I'm asking you.
Well, I would go with the signs that I showed. Now, you tell me some more. Because I'm talking about cyanosis.
As far as heart rate, things like that.
Yeah, are you talking about heart rates and changes?
Yeah, just some things we can tell everybody to watch for.
Flaring nose.
Drooling, flaring of the nose, jutting of the jaw, use of intercostal muscles, the retractions in the ribs, seesaw breathing.
Yeah, change those.
Belly breathing.
No, that's a real bad one.
It is, ain't it? I learned that in class, and then my next rotation, I had one.
You did. It's pretty obvious when you see it.
Yeah, it was crazy.
So have you learned that some treatments work better than others, like associated with what you see, like just off of experience?
Oh, absolutely.
Those tricks or tricks?
Yeah, I think so. And you know, the other thing is we talk about this in generalizations. You know, the kid does this and the kid does this. Everybody's so different. So being open to listen to what's being said to you, listening to what the child's doing, I think that would be what I would have to say. Because normally what's the first thing you're gonna do if somebody's in respiratory? You're gonna do oxygen, positioning, you know, head back. They're going into complete respiratory failure, okay? They're getting tighter and tighter and tighter and tighter. You've got the jaw out, you're doing all those things. You're giving them oxygen. You get them to the hospital as quick as you can, give them good fluids and all those things. I think that one of the hardest things, and I think that we all need to work on, is not to panic, because it's so stressful. When as a kid, you know, they're just, adults are just important, but everybody's, the stress level's up here. And so it's easy to make mistakes. So telling yourself, you know, get it together, hold on to yourself, and focus. This is not your baby, hopefully. It's not your baby. This is your patient, and those kind of things. And to me, that's some of the best things I've learned on my own. But as far as like treatment wise, like I said, you guys are the experts on the first aid at the house.
Something that I was worried about when it comes to kids is quiet.
Yeah, being too quiet.
Yeah, because like if they're crying, you're good.
Mm-hmm.
Like you get there, you get called for something bad, you get there and they're crying, they're upset.
That's
You're
the
good.
best
We don't
sound
need
in
to
the
be there.
world.
Yeah, it's the best sound in the world.
What about tips for dealing with the stress of it all, staying focused, not getting tunnel vision?
It's really hard
I
not.
think you might be a good expert on that
I'm
one.
asking the person that has more years.
What's the question?
Like, what's some tips to not get tunnel vision? And
Oh, you're cool.
Do
stay
you,
focused, do your
You
job,
want to be
stay
focused, but like I said, you've got to be doing that assessment of your people around you. You're wanting to see what they're doing, and also, as you know, just like I had to do in surgery, is all other people are patients that right then too. They pass out, they knock themselves out. They at regional that time, they let a lady come back to see her kid in surgery or post-PACU, and she fell and hit her head and died of subdural hematoma. That's why they don't let parents back there, because you can't take care of a child and it crashes so fast.
It's also really hard when there's something going on with the kid and the parents are both right there freaking out.
Yeah.
It's like you need to remove them from the situation.
Mhm.
Yeah.
And watch
You
it.
see kids with a lot of like, they got into things, they ingested things, like what were some telltale signs because they'd gotten into something? It wasn't necessarily that they were just having difficulty, or they were sick, but that it was they got into something. Or like, did you ever have cases where toxins or?
toxins around the mouth?
Yeah, and that's things that taste sweet too, that they can really get into. I didn't have to do much with that poisoning business. I can't think of it, other than that kid huffing all that aerosol stuff. I don't think I don't think I can comment on that, I don't know.
Do you get as much tunnel vision in a hospital setting? Since it's a controlled,
Yeah.
supposed
I
to be
think-
more controlled than what it is out here on the streets.
I think the best part about my part of being in the hospital is I have other people there with. I mean, no, I know you guys do too, but there's other people, like you've got a respiratory therapist, so I don't have to really focus on that part. You know, I have a physician who's doing this part, and I'm doing this part.
Server jack on trade.
That's right. So when he's talking about you guys getting tunnel vision, absolutely. I mean, you're concentrating on what you're supposed to be doing. But trying to keep your eyes open, keep an eye on what's going on, but don't panic. And I know you've heard that, I know you feel that, but it's so easy to just lose it inside. And especially with something that's just so emotional. And if it's taking care of somebody that resembles somebody you know, or it's the same age as your kid, or it's the same age, it looks like your mom or your dad or whatever. You know, something like that, you know how that affects everything. My sister died of COVID. So when I have people, I get tunnel vision when people start making fun of me for the disease, because she was more healthy than anybody knew. She was the second person in Vigo County to die of COVID. So when stuff like this happens, I see something that's serious and you think of your loved ones that you lost unexpectedly, and that's where you gotta focus. But by focusing doesn't mean just look right here. You know that, right?
COVID is weird. It affects different people in
Different ways, yeah, absolutely.
Different brands or breeds of COVID.
Well, you think about when my sister died, and she was the only second one, they didn't know how to treat her. The first one had already died just about 2 days before she did. She died like a week after she died, but they didn't know what they were doing, you know, taking care of her. So,
But treat the symptoms.
yeah. But they were so quick to put them on ventilators too.
Ivermectin, you done with. My granddaughter had it several times. She kept getting it. I'd go to Real King, get the ivermectin, squirt it out, take this and she'll be fine in the morning.
No, that's good.
But you go back to the other one, it may work on her,
But not on someone
not
else.
on somebody else. But most of the time, it works on everybody.
Good.
Take a whirl.
Michael, what else you want me to talk about? I wasn't too helpful on your last two questions. Well, I think I will.
Well, you also did women's health, so what's some pointers on women's health you can point out for us on the emergency side?
I'm gonna ask you to repeat that. I don't hear too much rock and roll in
You
my
said you
ear.
did women's health for a long time too, right?
Mhm.
And obese stuff, so can you point out some things that would be a help for us on the emergency side of things?
Yeah. Okay. You know, I know you know, that you don't ever stop the baby coming out.
Oh, come on, you like to get
Yeah,
a hold.
so they used to do.
Hey, you're holding into
And that
That's
causes
right.
cerebral palsy. It's the same with seeds of cerebral palsy now as you used to. Because that just cuts off oxygen to the baby's brain. But I will give you one tip, and you probably maybe learned this in school, but I didn't learn it in school, I learned it later. If you're off duty, you got none of your equipment, and somebody goes into labor, and it's inevitable that she's gonna deliver wherever she is, and you come in to help, okay? You, once the baby comes, and all you wanna do is slow it down. You don't have to, just don't let it pop out, because that just scares them off, it makes them
It's gonna happen naturally.
yeah, they're gonna come out no matter what. But if you slow it ahead, it does keep it from tearing so much. But then you put the baby on the mom, the placenta comes out, the placenta on the mom and the baby, wrap them together. Get it to the hospital. So just don't try to cut the cord, is what I'm getting at. No, not when
You
you
don't have all your equipment, she said.
yeah, when you don't have anything, yeah. No, when I'm talking about,
You don't have your cord clamps, you don't have,
Yeah.
you got nothing sterile or anything. But the reason I mention that is because just like you as EMTs and me as a nurse, if somebody knows that, and there's a problem, they're gonna yell at you. Right. Even if they need brain surgery, they're gonna yell at you. Or once you diagnose them, that's what they like to do to me too. So that's a real important thing, just the baby is gonna come out. Baby is going to hopefully cry. If it doesn't, you're gonna clean out its mouth, don't hit it. In the movies, I don't think you should do that.
battery
Blood to its brain.
And if you drop a baby, pick it up.
Yeah. Now
First lesson learned in the
Did you
EMT
experience?
school.
I was in a delivery with one of our top doctors in Terre Haute one time, and it was when we used to use delivery rooms, and there was a kick pan basin in the bottom of the bed. Baby came out and he lost the script and they fell in the basin. And he goes, looked up at me and goes, slippery. So we just picked it back up, wiped it off.
Which one always smoked? Constantly within the NICU. I forget he was the NICU doctor.
What year are we talking? Approximately, just decade,
What, late 90s?
late 90s.
It was in the new part, whenever the new part, 2000 maybe?
Was it Latino?
May have been.
He's I can't think what race he is.
This guy was an American,
Oh, he was a white American?
white American.
Then that's not him. I don't know if I can remember. But there's a lot of smoke.
We had a run down, I think it was Greene County. And we had to load up the NICU team, get going. We got the respiratory therapist, the nurse, the incubator. Where's Doc? Doc?
Oops. Oh, we just had a cigarette.
He was out on the sidewalk smoking one. Had to wait on him, finally
That's
Loaded up.
Old school.
had it out. Oh yeah, very old school.
Wow. Yeah. A lot of them still smoke, I think, but they don't show it like they used to. I had a patient one time, she said, I was doing her intake history, I said, do you smoke? She says, no, but I don't mind if you do. We laughed about that so long, because I could just see you standing there with a cigarette, and saying, now, how old are you now? Let me get that straight.
That's what Nicole does on Star. Is that the standard?
Okay, that's right. Gruber. That was a Gruber thing.
What else you wanna talk about, Michael?
Gotta know which part.
Whatever you think might be helpful to us in the field.
Can you think of anything, or can you tell me a story? So I can learn something too.
Haven't you delivered a few babies?
Huh?
Haven't you delivered a few babies?
I am still a baby virgin.
No, you are not. I know you delivered babies. It is one of my favorite stories that you tell. Yeah, come on, tell the story, baby.
I think he doesn't wanna tell it.
Or were you up front?
So what do you want to know?
What was the lie? What did you do?
Huh? With Norway?
Yes. Yeah, it was like.
Oh, jeez.
You delivered baby now.
So I've had my cert since '08, and childbirth was my favorite section of EMT class. Don't ask why, but
I know a lot of
It
these
just
kids
was.
loved it.
yeah.
I
And
don't know that any-
so for 12 years, I never had the opportunity, wasn't even remotely close to being in a situation.
Yeah,
And then on a hot summer, beautiful June morning, Saturday morning, I think 2022, I think, me and my partner got called out to Drug Court USA. We call it Drug Court because that's where all your pedophiles and druggies live. Anyway,
Cody, you're on.
and so anyway,
He gave no addresses.
we get there and basically the lady was in active labor. She was, my medic went upstairs and